In the previous session, we have discussed the celiac trunk, which is the main blood supply of the foregut. And today, we're going to discuss about the principal supply to the midgut, which is the superior mesenteric artery. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today, we're going to discuss about the superior mesenteric artery, SMA, which is the principal blood supply to the structures of the midgut. Alright, folks. Let's go back to the abdominal aorta. We said we have abdominal aorta and has got 4 unpaired branches, 3 of which are coming anteriorly. And of these anterior unpaired branches of the abdominal aorta, the second branch is called the superior mesenteric artery, and we say the superior mesenteric artery is the principal blood supply of the midgut, supplies all the way from the distal half of the second part of the duodenum, supplies everything in between until it reaches the proximal 2/3 of the midgut of the transverse colon. That's where the superior mesenteric artery supplies. One more time, the superior mesenteric artery is coming from abdominal aorta, just behind the neck of pancreas. At what level? At the lower border of L1 vertebra, which is almost 1 centimeter below the origin of the celiac trunk, and just immediately above the origin of the renal arteries on either side. This is where the superior mesenteric artery, SMA, originates. What are the structures supplied by the superior mesenteric artery? We've said this is the principal artery of the midgut. It supplies everything within the midgut, and it starts all the way from this the distal half of the second part of the duodenum, supplies the third part, supplies the jejunum, it supplies the ileum, it supplies the cecum and appendix, it supplies the ascending colon, it supplies the proximal 2/3 of the transverse colon, and that's where it ends. And the other part of the colon are being supplied by the by the arteries that are coming from the inferior mesenteric artery, and that's a separate discussion. We're going to discuss it sometime. What are the boundaries of the superior mesenteric? Like, what are the relationship between superior mesenteric artery and some other structures? So anteriorly, the superior mesenteric artery is anteriorly bordered by the pylorus part of the stomach. The stomach has been removed here. You can't see the stomach, but it's usually the pylorus part of the stomach is anterior to the superior mesenteric artery. But what other structures are anterior to the superior mesenteric artery? We have the neck of pancreas. As you can see, this is the neck of pancreas anterior to the superior mesenteric artery, but also have this vein, which is called the splenic vein. These are the structures that are anterior to the superior mesenteric artery. What are the structures which are posterior to the superior mesenteric artery, SMA? The very first structure that you can see here, just behind the superior mesenteric artery, at the origin of the superior mesenteric artery from abdominal aorta, we have the lefty renal vein, but we have the uncinate process of pancreas here. The uncinate, remember, the neck of pancreas is passing anterior to the superior mesenteric artery, but the uncinate process is passing behind the SMA. Okay, behind the SMA, and you can also see this is the neck of pancreas passing anterior, but the uncinate process is passing behind the superior mesenteric artery, SMA. What do we see here? We have a duodenum here. This is a duodenum. Which part of the duodenum? The transverse part of the duodenum. The transverse part of the duodenum is the third part of the duodenum, and the third part of the duodenum is passing just behind the SMA, between SMA and abdominal aorta. So these two structures are very important clinically, the left renal vein and the duodenum, in the third part of the duodenum. The left renal vein is at the angle between the superior mesenteric artery and abdominal aorta, and it can sometimes be compressed between these two structures, and this results into a nutcracker effect, a squeezing effect, a nutcracker effect. We're going to discuss the nutcracker effect when we're doing anatomy of the kidneys, but you know that it can be compressed here because it's between these two structures. But also we also have the duodenum passing between the superior mesenteric artery and the abdominal aorta, and it can sometimes very well be compressed between these structures, and it results into intestinal obstruction of the lumen of the duodenum, and it's very, very important, and this is called the superior mesenteric syndrome. Superior mesenteric syndrome, compression of the superior of the third part of the duodenum by the superior mesenteric artery between the SMA and the abdominal aorta. Time to talk about the branches of superior mesenteric artery. In summary, these are the branches from SMA. We have inferior pancreaticoduodenal artery, middle choric artery, the right choric artery, the iliochoric artery, and then we have a bunch of jejunal and the ilio branches that are going to supply the mesentery, maybe 12 to 15 branches. Let's start with the inferior pancreatic duodenal artery. This is the very first branch from SMA, and it's going to supply the inferior, it's going to supply the pancreas, pancreatic duodenal pancreas, and the duodenum, but from the inferior approach. It's going to anastomose with the superior pancreatic duodenal artery. Remember, the superior pancreatic duodenal artery is coming from branch of as a branch of GDA, gastroduodenal artery. Yeah, though the inferior pancreatic duodenal artery usually comes from as one artery, and then it bifurcates, gives two arteries, which is anterior and the posterior. So it gives anterior and the posterior branches in such a way that you have the anterior inferior pancreatic duodenal artery and the posterior inferior pancreatic duodenal artery. These are going to anastomose with anterior superior pancreatic duodenal artery and posterior superior pancreatic duodenal artery, and supply these structures of pancreas and the duodenum. This is posterior view. You can see it gives the posterior branch and the anterior branch. This is anterior view. It gives the anterior branch and the posterior branch. They are running on the that portion to supply the pancreas and the duodenum. And then the second branch is called the middle colic artery. The middle colic artery supplies the mid portion of the colon. Middle colic, mid portion of the colon. What is the mid portion of the colon? That's going to be your transverse colon. So it usually bifurcates also. This is a middle colic artery. It is designated to supply the transverse colon, but it bifurcates here to form the left branch and the right branch. We have right branch of the middle colic and the left branch of the middle colic. The right branch of the middle colic artery is going to anastomose with the right colic artery here. So it supplies, of course, the transverse colon, but supplies towards the lefty, towards the right spleen, the right colic fracture, which is the hepatic fracture, and it anastomoses with the right colic artery. And also the left branch is going to supply the transverse colon towards the splenic fracture, and it's going to anastomose with the with the left colic artery, which is a branch of inferior mesenteric artery. So understand it, treat this artery in 3 dimensions, and understand what I'm talking about here. And then the next branch is right colic artery. This is right colic artery. It's going to supply the ascending colon. But at times the right colic artery comes as a branch of the iliocolic artery. Of course, it should be coming from the superior mesenteric artery, but at times it comes from the iliocolic artery instead of the superior mesenteric. That is understandable, and it's going to supply the transverse, the ascending colon. It anastomoses with the right branch of the middle colic artery, and also supply its anastomoses with the branch of the iliocolic artery. Next, we have the iliocolic artery. This is the iliocolic artery, and the iliocolic artery has got two parts. It has got the ilium part, the ileal part, and the colic part. The ileal part is going to supply the ilium. The colic part is going to supply the colon. So we have two branches here. Yes, this is the colic part. This is the colic part. It's going to anastomose with the right colic artery, as we've seen, and then it has got ileal part that's going to supply the terminal parts of the ilium. And also we have we have the posterior cecal artery, which is going to the posterior side of the cecum, and we also have the branch which is going to supply the appendix. Is called the appendicular branch of the coming from the iliocolic artery. And then we have seen all of these branches. Almost all of them are coming from the right side. On the left side, we have a number of branches, maybe 12 to 15 branches that are coming from the superior mesenteric artery to supply the ilium and the jejunum, and these are called the jejunal branches and the ilio branches. A lot of them they're going to supply this small intestine. And then these branches, are coming forming something like arcades, like an arch, and then from arch we have the arteries that are radiating. We have the straight arteries that are coming from the arches These arches are formed by the branches of the by the jejunal and the ilio branches are going to supply different parts of the intestine, and these are called the straight arteries. The straight artery also called the arteria recti. Recta means straight, arteria means artery, but also can also be called the vasa recta, meaning vasa means vessel, recta means straight. These are the straight vessels or straight arteries, or vasa recta, this one. But something to note here, the vasa recta of the jejunum are usually longer. The vasa recta are usually longer in jejunum, but they are a little bit shorter when compared to the ilio branches, with the one that are coming from the ilio branches. And then we have something very important clinically called the marginal artery of Drummond. The marginal artery of Drummond. What is it? We have on the inner side of the colon, we have the continuous arterial arcade, which is joining different branches that are going to supply the colon. So the branches that are going to supply the colon, they form the continuous arc or arcade, which is called the marginal artery, also called the marginal artery of Drummond. Marginal artery of Drummond. This is very important because it is an anastomotic channel between the branches of the superior mesenteric artery and the inferior mesenteric artery that are going to supply different parts of the large intestine. It's very, very important. The marginal artery of Drummond is found only on the large intestine, and it's a single artery. It's a single continuation, and this is why it's called the marginal artery or the artery of Drummond. But the marginal artery of Drummond is not present to everyone. Only some people have this anastomotic channel that is enabling them to shunt blood from different branches of the superior mesenteric artery and the inferior mesenteric artery. Why is the marginal artery of Drummond important? It's important because in case we have blockage of the inferior mesenteric artery, for example, the part that was supposed to be supplied by the inferior mesenteric artery would undergo ischemia and they would die. But because of this marginal artery of Drummond, we have blockage of the inferior mesenteric artery, but we have a blood which is shunting from the branches of the superior mesenteric artery, and they are going to supply this part of the colon that was supplied by the inferior mesenteric artery. So we have an anastomotic channel to make sure that we can shunt blood from the superior mesenteric artery to supply the part of the inferior mesenteric artery in case we have obstruction of the inferior mesenteric artery. Same applies when we have obstruction of the superior mesenteric artery. We can have blood coming by the way of the inferior mesenteric artery supplying this part of the colon. But this is only for the large intestine. Doesn't apply to the small intestine. Does not apply to the small intestine. That's the marginal artery, also called the artery of Drummond. We have already seen the vasa recta, and the vasa recta, these are the straight vessels or straight arteries, and these straight arteries are coming from this arterial arcade. So even after the marginal artery, you have the straight arteries that are, these are the straight arteries that are going to supply this specific part of the large colon, of the large intestine and the small intestine. And this is what we see. These are the vasa recta. You have the marginal artery of Drummond, and then we have the straight vessels that are going to supply the large intestine. We've also seen the vasa recta on the small intestine, coming from the ilio branches and the jejunal branch. And I've told you again, the jejunal vasa recta are usually long, and the ilio vasa recta are usually short. Usually short, and this is because the jejunum has got small number of arcades as compared to ilio branches. They have a lot of these arcades. Remember, one more time, the marginal artery of Drummond is not present in the small intestine. It's only present in the large intestine, to make sure we have anastomosis between the branches of the superior mesenteric artery, and the inferior mesenteric artery, and it's ensuring collateral circulation to the large intestine. And I've explained what a collateral circulation is. In case of blockage of the inferior mesenteric artery, we have blood which is coming from the superior mesenteric artery to supply this part that was supposed to be supplied by the inferior mesenteric artery, to make sure everything goes smooth. Let's talk about the clinical significance of the superior mesenteric artery. We have seen the superior mesenteric artery supplying all the way from the distal half of the second part of the duodenum all the way to the transverse colon. Okay, so in case we have obstruction of the superior mesenteric artery, we have the bowel ischemia. A large part of the bowel will undergo necrosis because they're receiving blood from superior mesenteric artery. Okay, it's most common to happen in the small intestine because in the large intestine we can have that anastomotic loop through the marginal artery of Drummond, but I've told you the marginal artery of Drummond is not present to every person. It's not present to every person. Only some people have this advantage of getting blood shunted from the superior mesenteric artery to inferior mesenteric artery and the other way around, and this is the bowel ischemia due to the occlusion of the superior mesenteric artery. Watershed area is a region that receives the blood from the most distal branches of two anastomotic arteries. Well, it sounds scary, but make sure you hear what I mean. You have branch from the superior mesenteric artery. We have a branch from the inferior mesenteric artery. This branch are going to anastomose at this region, and then this region is receiving blood from two arteries, two anastomotic arteries, but receive the most distal, the most weak pressure from these two arteries. And this is important because in case of hypotension, in case we have a low blood pressure, the blood is less likely to reach at this region, and this is why this region is called the watershed area. Okay, in case of systemic hypotension, this part is vulnerable to ischemia because the blood will come all the way to this region. It will end here. The blood will come by the way of the inferior mesenteric artery, will come all the way to this region, will reach here. So this point becomes ischemic, and this is what is called the watershed area. So in the large intestine, we have two important watershed areas. We have the Griffiths point here on the splenic fracture, but also have we have the Sardex's point here. We're going to discuss it when I do anatomy when we're discussing about the inferior mesenteric artery. So this is Griffith's point, and the Griffith's point is very important because it is the watershed area between the branch of the superior mesenteric artery and the branch of the inferior mesenteric artery. The superior mesenteric artery is sending here the right part of the middle choric artery, the left part of the middle choric artery, but the inferior mesenteric is sending the left choric artery, and they're going to anastomose at this region. But in case you have systemic hypotension, you have low blood pressure, the blood is less likely to reach at this point because this is receiving the most distal branches of two anastomotic artery. Also, in case of hypotension, the blood maybe will come all the way to this region here, but it's less likely to go to this region, and then this region becomes a watershed area. Okay, let's summarize what we have discussed today. We have the superior mesenteric artery. This is coming from abdominal aorta at what level? At the lower border of L1, which is approximately 1 centimeter below the origin of the celiac trunk, just above the origin of the renal arteries, and just behind the neck of pancreas. We have seen anteriorly covered by the neck of pancreas and the splenic artery and the splenic vein in the pylorus part of the stomach, but posteriorly we have the third part of the duodenum. We have the left renal vein coming, and also the uncinate process of pancreas. And we have seen what are the branches of the superior mesenteric artery. The very first branch we said is the pancreatic duodenal artery. This artery is going to supply the inferior most portion, and then of the pancreas and duodenum. And then we have the middle choric artery. The middle choric artery has got two branches, the right branch and the left branch. And the left branch is going to anastomose with the left choric artery here at the splenic fracture, and this is the watershed area. The one among the watershed area between the superior mesenteric artery and the inferior mesenteric artery, and it's called the Griffiths area of the Griffiths point. Okay, the second branch we've said is the right choric artery. This right choric artery is supplying the ascending colon. It's going to anastomose with the left branch of the middle choric artery. It also anastomose with the iliochoric artery. The iliochoric artery, I've said, has got two parts. It has got the iliochoric has got the choric branch and the ilio branch. The choric branch is going to supply the ascending colon, but the ilio branch is going to supply ileum. We have seen also we have the appendicular artery that's going to supply the appendix, but we have the the posterior cecal artery that's going to supply the posterior part of the cecum. We also have the anterior cecal artery that's going to supply the the cecum. We have seen we have the marginal artery, or the artery of Drummond, which is continuous arcade, that is anastomosing, that is leaking, that is rinking different branches that could supply the large intestine. But we have also seen we have the jejunal and the ileal branches, a lot of jejunal and the ileal branches that are going to supply the ileum, and the jejunum. All right, folks, see you next time.